I just want to talk to you a little bit about what's happened with DSM-5 over the last 5 years. So it's been a long time in the making, DSM-5. There was a lot of debate around the PTSD kind of diagnosis, particularly around between 2005 and 2007. So that's when it started, where people were asking a few questions. One, they were asking about PTSD as a diagnosis. Is it a legitimate diagnosis? It's the only diagnosis in DSM-4 that has its first criterion as an event, a traumatic event, and a person's subjective response to that event. Any other DSM-4 diagnosis is is only based on symptomatology and etiology. This is very different. So there was a lot of controversy, and actually a lot of people saying we need to get rid of criterion A. Or is criterion A, which is having experienced a traumatic event and having a subjective response to it, this is not a legitimate way of defining a set of symptoms and problems, because essentially the DSM-5 is about planning treatment. That's why it's been created in the first place. And does it help you thinking about what the person went through or not, and resulting in a certain set of symptoms? So that's the first thing that we'll talk about. The other thing that's happened with DSM-4, in DSM-4 there is nowhere in the DSM-4 where we speak clearly about complex trauma or the complexity of a traumatic event. You have borderline personality disorder that might be representative of the kind of symptoms you might see for complex trauma. You have somatic disorders that might be very well related to complex trauma, and you have the associated features of PTSD that touch on aspects of complex trauma. But you don't really have a disorder as such that describes what happens if someone has been through childhood trauma or a long duration of interpersonal trauma. There's nothing in the DSM-4 as such. And so there's been a lot of push for a separate disorder to be included in DSM-5 as well. And we'll talk about how that's going at the moment. The third thing that's happened with the diagnosis of PTSD, is my voice going down? Yeah? The third thing that's happening with PTSD is that in order to have PTSD at the moment, you only need to re-experience trauma, once or twice, and you get the diagnosis. It's not very specific in terms of re-experiencing, and I'll talk to you a bit more about that in a minute. So I'll talk about those things, and then weave that in what that means for complex trauma.